everyone, and welcome. Welcome. I am super thrilled, super excited for tonight. Tonight is just going to be a grand night. I'm excited. I'm so very thankful to be sitting here with some amazing, amazing colleagues of mine who have spent the last almost year really doing the work to improve access to communities of colors. They're going to tell you about their journey. They're going to tell you about what we've been able to do, what they're doing now in their own personal, professional lives. It's just going to be an amazing time. But before we get started, I just want to again thank each of you for all of the support you've given our team. I want to thank you for ensuring that we were able to communicate with you, ensuring that you reached out to us and we were able to reach out to you through our social media channels, through our emails. Thank you for the support. Thank you for jumping on, hopping on as we continue to do this work. I am pleased. I am excited for the work we've been able to do through our Equity Pulse campaign, through our Improving Access. It's been a journey, and I'm sure our team will tell you it's been a journey. These young ladies and young gentlemen, young man, they have fought the fight, the good fight, the pressing through, even when people were tired. They did what mentees do and they pressed forward. They have taken improving access and really have created a model that I believe you, your company, your organization, will benefit from. But we hope and we pray that you, as people, as just individuals, will continue to live healthier lives. You will continue to strive to live healthier lives. Those of you who are in leadership or in healthcare, you will continue to impact health equity. You will continue to engage in the fight through government, through lobbying, through whatever it takes, being a voice for those who are do not have a voice, for those who are voiceless. So tonight, I welcome you to our journey, our reflecting on our improving access journey, on their journey. I encourage you to sit back, listen, make sure that you feel free to reach out to any of these amazing individuals for assistance guidance, paid assistance guidance. For consulting, because they are able to do it. So I welcome you again. Tonight, we're going to jump right into it. I'm going to just introduce, our team will introduce themselves, but I want each of you to just talk about the role you played in improving access. What were some of your responsibilities? Give us your name again. I know your name is on the screen, but just talk about your responsibilities, the role you played, and what you're doing now. All right, we'll start with Miss Josine Thompson.
My name is Josine Thompson. I was the director of social media and marketing. I was in charge of daily responses on social media, and as well as making sure that the information just got out about what we were doing on a monthly basis, all of our talks that we were having. So that was pretty much my job, and per se. And what I am doing right now, I am just finishing up my master's degree in justice involved. So I am looking forward in completing that within the next couple of weeks.
Awesome. Thank you. Thank you so much. Let's go to Keisha Bentley.
Hello, everyone. My name is Keisha Bentley. I served as the Director of Research with Improving Access, and my responsibilities for this role really involve taking a different role than I've done in any other aspect of even my professional life. I had to be the editor. I've written papers before, and Dr. Howard has helped me in that area. So I've been blessed to be published, but I've never really served as an editor before. So when the LinkedIn articles went out, I was tasked to edit them before they actually did go out. Um, I also helped to develop questions that we were working on for the talks. And the biggest project, which has yet to come forth, but is working on a paper that will highlight all that we've done this year. Um, so, what else do I do? I am currently in my second program at Morehouse School of Medicine. I am in my second year of the DHA program, first cohort. I will finish next year. I'm working on my capstone, and I work as a STEM education specialist, and that's pretty much me.
Thank you. Thank
Yeah.
you. And next we will go to Marcus, Mr. Marcus Jackson.
How's everybody doing tonight? My name is Marcus Jackson. I'm the Director of Community Outreach for Improving Access, and pretty much my role was to bridge the gap in health education for underserved communities. We looked at different community partners and different people to speak on behalf of different topics, and my job was to facilitate and find either physicians, community leaders, just to speak and give their thoughts on really share their insights. We had a really good time just finding different people who have diverse backgrounds and coming together and talking about healthcare. So I look forward to doing that more in the future. Currently, I serve as a community influencer here in Nashville about sharing vaccine access and just talking about vaccines and what Tennessee is doing here with COVID as well as influenza. I also serve as a behavior analyst for the state of Tennessee, mentoring young children, and I look forward to pursuing medicine in the future.
Awesome. Excellent. Last, certainly not least, Miss Charity Walsh.
Good evening. My name is Charity Walsh, and I serve as the Director of Operations for the Improving Access Incorporated team. Basically, I was responsible for just making sure that we stayed on target with the goals that we set for ourselves, making sure that we stayed aligned, aware of everything that was going on with each other and with the project, and really just making sure that we were able to do all of that efficiently. Outside of improving access, I work as a technology specialist for a large hospital system with their scheduling platform. And look forward to continuing that. I love all things health technology. And so I'm just really looking for other paths to continue exploring that.
Awesome. So you all, this is our team. This is our Improving Access team. They have done, as you could hear, tremendous work over this last year doing the work of how we improve access. So speaking of thinking about, some of the things that we've been able to do, where do you all see improving access going in the next 5 years? I mean, if as it journeys on, and just not improving access on the scale of what we've done or the organization improving access, but improving access at large, where do you see this going in the next 5 years? Let's start with Marcus.
One of the things that I think it will be really innovative is just using more technology in health literacy and just improving access in general. We have so many technologies as far as AI or virtual reality to smart bandages to CRISPR, just all of these different technologies that people may or may not even be aware of. And how do we get that to the public? How do we just change and use our current social media? And just you look at Facebook. Facebook has over 1 billion people on it. Social media, Instagram as well. how do we get the everyday people as well as different age groups to really buy into healthcare and use of these technologies? So that's one thing I'm really excited to really see how not just improving access, but how healthcare at large incorporates these things, not just in the US, but globally. Because as we have more countries getting more familiar with social media and how social media works, we can share more and learn more at a quicker time than maybe just having one country pretty much target a specific health issue.
Right. Good. Yeah, absolutely. Keisha, what are your thoughts?
Improving access in general, I would say that I think it's important, as Marcus even mentioned, health literacy. For those who do not know, which is probably a lot of people, I am in education. I taught for 14 years. And so in that time, I had the opportunity to see um, that there are very big gaps, not just in education, but also the ones who have the education gaps tend to fall into the healthcare gap. So it would be nice to see health equity really being promoted and addressed, not just getting the word out, but doing more to ensure that the people who do not have now have access to what they need. And especially with health literacy, just understanding what they're given. There are so many people who go to doctors' offices and they're still not sure. They're not certain about what they've just been told, what that means for them. And nobody, it's like when you're a teacher, you can't go home with the kids. You don't know what they do once they go home, but it's the same with patients. When you have patients, you don't really know if they're doing what you've asked them to do or how consistent they are with it. But, it would be nice to see at some point that gap being bridged so that those deficits will, if hopefully no longer be there, but at least that maybe if we're taking baby steps, that those deficits would become smaller and smaller. Um, so, yeah, I just think it would be wonderful to improve access to healthcare to all people. And I know that's not the easiest thing to do, but that's okay because we've got lots of people who want to work and see that happen.
Yeah. All right, Charity. Thank you, Keisha. Charity, what are your thoughts?
Well, I'm all about the community.
I think there might be some technical difficulties, so we will go to Josine.
Well, my sentiments are basically echoing what everyone else is saying about community and just the community outreach. And I think that we're living in such a time where the communities are more diverse more than anything else. And so I would like to see where, there's definitely more community outreach, more awareness to these communities of color within the long run. I think it would be beneficial to just making it bigger than what it is now, and just having that outreach that is very important.
Yeah, so you all touched on some really, really great things. Community outreach, social media. These are depth research, teaching. These are things that certainly people, no matter where they are, from socioeconomic background status, organization, can really do to improve the access for people, so that people know and realize, hey, I have more and more access. This is the way I get, access. Some of the many of the platform, or much of the platform, our equity post was really around social media. How do we use social media? Because social media is widely spread. Social media is a community within itself. So thinking about some of the areas that we can tackle across healthcare, what area would they be? What area would it be, if you could tackle, and each one of you can answer this, what area would that be and why? Whoever wants to go first.
I'll go. One area that I think we can improve greatly in, I touched on a lot of the technologies earlier, but they'll be in vain, in my opinion, if we don't address the need of mistrust in underserved communities. And one way we can improve that mistrust is demystifying the process of clinical trials and just what are clinical trials, how do we engage in them, because they're very beneficial. Between 1993 and 2017, we've only had about 5% of African Americans applying for clinical trials, and that's a grave injustice because one, we're locking ourselves out of improving healthcare for our communities. One example, when the process of clinical trials occurs, they need a new drug to be tested. They need people to try these drugs. If you only have one population that is partaking in clinical trials, you cannot effectively say that this same treatment will be applicable for all populations. And when you don't invest in these processes to really disseminate information surrounding clinical trials and just our involvement on both sides, not just the testing, but also getting the vaccines themselves or getting the treatment themselves, then we really hinder our possibility of longevity, in my opinion.
Yeah, so right quickly, if you could give us a sentence or two for those that may not know. We just talked about health literacy. What is clinical trials? What does that mean for a person to do a clinical trial? What does that mean?
So a clinical trial, let's say we have a issue such as heart disease. Heart disease is one of the number one killers in African Americans. A way of treating heart disease is actually having a drug go through a tested, first off, R&B is a process and a company that actually is in charge of making sure that every human or animal experiment is ethical, because we go back to the question of mistrust. We look at historical data, such as on cases such as the Tuskegee study, and how, or even the Henrietta Lacks, with how they took her DNA without her consent. Clinical trials and the IRB company and large are there to pretty much say and give regulations on how these experiments are going to be taken out. So to give you an example, take in consideration if there is a new drug for heart disease. You can go and actually have a experiment with actual people in which the drug is actually performed. And it goes through rigorous tests. It goes to tests before it's even administered into the actual human body to make sure that there's no harm. And you also get benefits depending for partaking in the clinical trials. So once the clinical trial has a certain number of people who are participating in it, then it can see if this drug actually helps the disease or it doesn't do anything. And then you go back to the drawing board again, and then you find the next drug. And through this process, we hope to find an actual drug that's beneficial for not just the one population, but multiple populations, because disease manifests itself differently in every human being. So,
right. Yeah. No, thank you. Yeah, no, did I interrupt you? Go ahead.
So pretty much clinical trials, and one, I know that was a mouthful, but and one phrase is an experiment designed, a ethical experiment designed to benefit and identify ways to treat disease.
Thank you. Thank you. Yes. And so, the reason why that's important for especially communities of color, because one drug doesn't fit all, just like one size doesn't fit all. And so it's better for us to go through the clinical trials and have someone to watch, have a team of healthcare providers that can give you normally free uh, guidance to better outcomes of your life. I'm going to go to Keisha or Josine. If you could tackle one area in healthcare access, what area would that be and why?
I can go ahead. Uh, Now, I will say this. This is also what I'm working on for my capstone. So I'm not going to say too much because I'm going to write a paper on it
That's
this
fine.
year.
That's good.
But one area that I'm interested in terms of improving access has to do with um, giving mothers, pregnant mothers, resources that they need to support them in their postpartum phase.
Mm-hmm.
Okay. I think that that period of time is not often what people think about. They want to, there's always talk about prenatal care. But what about the moms after the baby is here? So, I've seen that there are a lot of moms who are dying, and of course, those numbers are greater in women of color than they are in other groups. And so, and also in southern states more than other places in the US. So, I think it's important to address that particular demographic and to give support in that general area. The one reason, and I won't say any more about that because I am researching and writing on it now, but um, the one reason that I am interested in this, I've always had an interest in medicine ever since I can remember. Um, and I've seen deliveries of babies and just kind of been in there and been interested. And when I was an undergrad, I did my senior project on uh, postpartum mood disorders, postpartum depression, and other mood disorders. So I still have that interest. And I thought I would just take it a step further because there are some women who are dying as a result of postpartum depression. Of course, there are other reasons as well, but the biggest thing I think is to tackle that and to have fewer mothers who are dying. You don't want anybody to die. I know everybody's got to go at some point in time, but some deaths are unnecessary. And that's one of the things that so far that I found in my research is the case with mothers who die in their either during delivery or in their postpartum period, where it could have completely been avoided. So
Yeah, and that kind of brings thought about, when we talk about laws and governance and companies. Several companies have done a better job of giving moms time off, but you also have to, it's one thing to have time off, but then paid time off and actual care for the postpartum. A lot of women have suffered, have unfortunately passed away, but there's a a great work. And again, because this is your project, we won't deal with it too much, but that is something that is ongoing, especially in communities of color, Black women, that need to be addressed. And so we can't wait to see what your outcomes will be and how you will continue as you move through beyond your doctoral degree, but how you will address this worldwide. Josine, did you have anything you wanted to add?
I do. I was taking a bit of notes, but since my direction is with the justice involved, what I would like to see in healthcare is just basically diversity and, giving them access, as they come back out into the community. What does that look like for them? I know it opens up a whole can of worms, but, what does that look like for them as they enter into the community and what it looks like for us as well. How do we welcome them back into the community so they don't end up back as a menace to society per se? So that is one area that I would like to see be improved within healthcare.
Yeah, that's really um really important, because so many people who are just as impacted are, you know, they're physically fine when they go, in, but then by the time they come out, sometimes even months or a few years, they have high cholesterol, diabetes, all of these chronic diseases, because of what is or is not happening while they are in the justice system or the correctional system. So that's a big piece, a big part of what we have to continue to fight the work. Again, that is beyond where we are now, even in your program, in your Masters of Administration, Justice Involved Care. Looking at policies, how do you deal with policies, a better diet, a better for those who are impacted by chronic disease, what kind of meal plans can they have, making sure that there are certain supplements that are given, and not just, and that goes back to the clinical trial, not just the one drug for everyone. So ladies and gentlemen, thinking about your pursuit of healthcare access and equity in your future endeavors, what does that look like? I know that I know what each of you are doing, but where do you want to go from here? Where does your pursuit of healthcare access look like in your future?
I'll start.
Sure.
I am still mapping things out. Okay, I have a year left before I graduate. But in my head, I see myself probably in a hospital. And also, of course, with the Doctor of Health Administration, um, obviously a leadership role. But I want to take my experience in education, which is where the health literacy comes in, and try to parlay that. I think that it could be very useful to incorporate education into healthcare, and not just for the people who are practicing medicine or working with patients in any capacity, but also for people in the community.
Awesome. Thank you. Marcus, what about you?
Now, this year has been really transformative for me because I've learned that whether you're in a clinical setting, you're in the community setting, any type of work that you do towards healthcare always needs some type of dialogue and always needs some type of forum for feedback. And I think no matter which route I take, I wanted to develop that and really get the message of you control your healthcare. You deserve a right to healthcare. What does that look like, and how do we fight that fight every day? So I don't know, like I said, what path that takes for me. Whether it's art, I'm an artist, so I use a lot of my art to talk about different topics, healthcare topics, mostly around mental health. Um, but also, how do we transform messages or centered around healthcare into spaces that people enjoy? Because a lot of times you will talk about healthcare in the hospital or maybe around the dinner table if someone is sick. But if you can talk about it in a setting that is more comfortable, let's say even at a concert, maybe over and you're out enjoying yourself just in spaces where you don't necessarily think health is present or healthcare is important, that might be a message changer in how we deliver our messages. So I don't know what that looks like, but that's what I'm headed towards.
Yeah, and you don't, just like Keisha, you don't have to necessarily know. you don't have to know. And speaking of messengers, because who's been our messenger to be our mouthpiece out here through our social media, Josine, what about you? You have
I am
anything?
like
Yeah, go ahead.
I am like everyone else where I am mapping things out myself just to narrow things down of where I want to go from here. And I am really liking the idea of counseling with mental health. That is my thing. Don't know why, but in every aspect, I really enjoyed. I like the turnaround of just having a down and out time, and just uplifting that individual. Wherever it may be, with like I said, with justice involved, substance abuse, wherever that may in that realm where it may be. So I get a kick out of, and I get the joy out of just the turnaround in itself, turning that bad aspect into something good. So that's why I see myself moving on from this point on, just narrowing down into being some kind of counselor with mental health.
Yeah. I started off, you guys, I tell my story often. I started off as a music teacher. But the funny thing is, in high school, they had a CNA program, a certified nursing assistant program. I did that. And because I thought I was going to be a nurse, I wanted to be a nurse. But I had, like, when we did some rotations, I had a bad experience. And because I ended up getting a music scholarship, I'm like, let me go the music route. So I say that to say that's where I started, but my heart has always been in, some level form of healthcare. And years later, my path was redirected. I went through the education route, and my path was redirected. And so glad that it was. So, our paths look different. I think that, we don't always know, but we follow our hearts. And sometimes it'll lead us one way, sometimes it'll lead us another way to get to the destination. And the great thing about exploring is that when you explore these different opportunities, when you explore different uh, interns or different jobs and roles, you kind of figure out what you love or what you like. I don't think anybody loves 100% of what they do. They may love like 93, 94, 95, and it's that 5% they wish they could just throw away. That just comes with life. It's like you may love your house that you live in, but you don't necessarily like washing dishes, or you don't like folding clothes, or things of that nature. It's just that little piece, but it won't make you throw everything away. So I say to each of you, as continue your journey, enjoy it, embrace the good things, embrace the joy of what you love, and those things that you don't, figure those things out too. But as you maneuver, it's not a straight path. It doesn't have to be a straight path, because even for those who have taken a straight path, they have, sometimes they say, okay, I want to go from this degree to that degree, then do this. Then they end up doing it, but then they don't end up always loving it. So it's okay to be on a journey. It's certainly a marathon, not a sprint. So as we are kind of wrapping up, talk to us about, what advice would you give your younger self, or even from the beginning of this journey? What, thinking about some of the things that you've done, experienced up to now, what advice would you give to your younger self? Let's start with you, Josine.
My advice, so many. But one would definitely be do not take forever to do what is in your heart. Try to get it done, as soon as possible, so you can see the mistakes and you can correct them right then and there. I try to tell my kids all the time, don't wait 10 years to go to college. Not like anything is wrong with that, but take advantage of the opportunities while you're young. Even if you go through it slowly, take advantage of those opportunities, because you may get older, and as we get older, there's a lot of discouragements, and there's not enough time to fix those discouragements. So definitely do not put off what you can do today. Do not put it off for tomorrow.
Do not put it off for tomorrow. All right. Yes. Keisha.
I don't know if it would be so much to my younger self, but even for a new cohort that's coming through, I would recommend that they remain. First of all, I'm only assuming that they would be enthusiastic to start with, but to remain enthusiastic and to be curious, because curiosity is what is ultimately going to fuel the drive to complete the different tasks and challenges that come. And as long as you have the stick to itness, I believe that it's ultimately possible to do so much. But having a group of people who are enthusiastic, will do the work, as Josine mentioned, do it on time. I think that's very important. And remembering that as you're working with the team, if you got people who are coming from different places, none of us knew each other when we started. So, and it's a very, I guess, a short period of time where you have to get to meet people, learn people, figure out how you will best work together. So I think it's important to come in open minded enough to be able to work with others, find that common goal, and make it happen.
Work together, find that common goal, make it happen. Stay enthusiastic. And that's, even with our roles, our jobs, you have to find something that you love, because if you don't find something that you love in your career or what you're doing, it will become daunting. It will become a task, and it will drive you insane. So, thank you for that, Marcus.
So the biggest thing that I would really learn on this process is just staying level-headed and not being frustrated, because it's will have like challenges that arise for things that you may know, things that you may not know, and it's a part of a learning process. And don't get discouraged. Always, also knowing who you're working with is very important, because you might think that you might have some things going on in your life that can hinder you from performing to your best of ability. But if you have other people that you can lean on, that's very important. So, and just knowing what's going on in your team's lives can really make your project that more meaningful and that more impactful. So, just staying not true to the message, like the ladies iterated earlier, um, sticking to it, but also knowing your team is very important, and knowing like yourself too, understanding your limitations and knowing when to say no, knowing yes, I can do more. So that's my tidbit, my TED talk.
Yes, I can do more. Sometimes, I mean, I guess we just pushed, even though all of us were tired. It is a big undertaking. It is a huge undertaking. I, you know, I even myself, because of my new role and transitioning, um, and having to build, new students and things of that nature, I'm going to take a gap year of this, unless y'all want to come back for round two. No, I'm just playing. But it has really been, y'all weren't supposed to laugh out loud at me, but it has been it's been an amazing journey. We pushed through it. But I believe in my heart, I'm better for it. I'm wiser for it. I have learned so much from all of you. Unfortunately, Charity's technology just had a fit today, but I've learned from each of you. I've gotten better because of what you all have taught me. and what we've experienced together, some of the things that I didn't know as much about, but we've learned and walked them together. And so my hope, as we draw to our final question, my hope is that each of you will take something with you from this project, that you will stay connected. Who knows? As y'all are CEOs, you better come and get me. Let me consult for you as you become your doctor, Dr. Jackson. You're gonna need somebody to run your office. Hey, I'll come let me set it up. Same thing, Keisha, as you're running your hospital administration. I don't want to be there full time, but come and consult me for some education, some training, some organizational structure. Same, Josine, as you are setting up your therapist session, let me engage with the church, the community, to help make sure that the work that we're doing, that those who are impacted by the justice system are getting the help. And guess what? Charity will have y'all information technology for all of y'all offices. She will be, the CIO or whatever she wants to do to make sure she consults, to make sure y'all's technology infrastructure is doing what it is supposed to do, and that your whatever your health electronic health records, all your AI stuff, she'll be doing those things. So we'll work together to make sure I project manage on her team. All right. So it's been such a pleasure to pull through this and to see the growth from each of us and what we're doing. So my final question to each of you is, what was your most memorable experience? What was your most memorable experience? Whoever wants to jump in and go first, go for it.
I will go first. My memorable, I would like to say, would be just social media in general. It is definitely not as easy as you think it is. Just throwing stuff out there. You definitely have to know your audience and what they like, what they want to see on a daily basis or weekly. But that for me was my most memorable, just learning social media.
Yes. Yes. And you are our social media queen. All right. Who wants to go next? Keisha, what was your most memorable experience?
I would say my most memorable experience is really working with a whole new group of people. I'm not a stranger to working with different groups, and education is something we have to be able to do. Um, but it's kind of cool working with people from different walks of life. There wasn't anything else that I don't know that we ever would have met each other any other way except through this. So, I'm grateful for the connections and the friendships. Like, you really feel like you have people you can talk to even about things that are outside of improving access, and that's wonderful too. So I tend to be a very sentimental person, and I value relationships. So no matter what we can do as a team, I think to me, the bigger value are the relationships that we have beyond that. So that's mine.
Awesome. Last, certainly not least, Marcus.
I honestly enjoy working with everybody, but even more actually on our panels when we got to interact with our guests. And we had some amazing guests talk about brain cancer, talk about Alzheimer's, talk about heart and healthy care. And the biggest takeaway from those was they are all different ages, coming from different generations, different walks of life, and they really gave insight that our viewers could really find a lot of use in. And I thought that was powerful that we were able as a team just to connect these people.
Yep. Well, you heard it, you all. Thank you so much. This has been an amazing journey. Though we still have a little work to go, we have conquered so much, which means there's so much more to do, which means there are so many more opportunities. And I would just say, if you have not connected to Josine, Charity, Keisha, and Marcus, connect with them. These are some incredible, amazing young men and women of color who are doing amazing work in the health science, healthcare, health justice field. And they will be your next leader, your next C-suite, your next C-suite in all places. And so I just want to thank each of you for your commitment to improving access. I want to thank each of you for the work that you've done with me, for us, to really impact the lives of others. That was our goal. That's what we wanted to do. That's when we set out to do this. That was our main focus, is to get the information out there, to make sure that people had it. Now, what people do with it, we can't control that. And that's, that's not the weight that we carry. Our weight was, and I remember in some of our initial conversations, well, how will we know if we did what we were supposed to do? Do y'all remember that? And that is, we did. Do y'all believe we did what we were supposed to do? We got the information out there. Hopefully people are using it. Hopefully people are seeing it. But we've done, I believe, what the Lord would have us to do, and that is to educate others, to share, to make sure that people have the information they needed to make better decisions, different decisions. So for that, thank you. We still have a few things to tie up. But this is improving access, and this is reflecting on our journey as a team. Thank you all so much for watching tonight. We wish you a happy spring. It is springtime. And thanks again for all the work that you four have done to impact this team. Thank you, everyone, and have a great night.
Thank you.
Thank you.
Bye-bye.
Thank you.